Hello, Assalamu alaikum. This is Asad from Riyadh, Saudi Arabia, and today is a global health exhibition in Riyadh. I came here to see, and also I will show you guys about this exhibition, what new things I will see, and I will show it to you. Let's tune with me. Thank you so much.
After that, you see your application topics. You see you have lung, musculoskeletal, superficial, soft tissue, and vascular.
So this probe.
This probe has these ones.
Can be visualized all the
Visualize
lungs,
all.
musculoskeletal,
Everything. Yes.
vessels,
Yeah.
vessels also.
Vessels also. Let me show you, for
Your
example.
carotid, okay.
Yeah, my carotid. You
Yeah.
see?
I love this one. Just like her machine, so nice.
It's like for ICU. That's
Yeah.
we used to do it and ICU.
And you have you
it's
can
very-
see your cannula
Yeah,
directly from here. You also can have color flow.
Yeah.
for the flow. Yeah.
Oh, it gives you the depth too. You know the.
Yes. Horizontal
Yeah.
or triangle.
Yeah.
So that you can check if it's a really vessel or a kind of any other hematome there, because it seems black. I don't know which specialty are you dealing with?
Renal.
Nephrology.
Renal. Okay. Yeah. So you also can have abdomen probe.
The same or
Yeah, the
different?
same. So you just take this
Okay.
and put the convex one here.
Emergency catheter.
Yes, temporary.
Yeah, temporary catheter.
Temporary catheter. Yes.
Dialysis.
Yes.
And that's it. And you can do all your application in abdomen, in convex transistor. You have your abdominal imaging. You have renal application as well. And it's very easy, just in your pocket. It's the whole system
Can be connected to any device.
By the way.
Okay, so if I drop this, what will be the impact?
So it is durable. We have tested the durability, but
Yeah.
of course it's not the situation that we really would like to have.
Yeah.
But it's durable to drop. We have done my drop tests.
Yeah.
It will not
Of
affect.
course.
It will not
Yes.
affect the
Yeah,
quality.
not first time, not maybe second time, but of course it's according to how height you are like dropping it.
Yeah.
So the Google glasses.
Yeah.
They do the drop test, but it can be damaged at the end for sure.
Oh, that's why they're wearing this now.
We have a specialty. There are special type of dialyzers for a patient who faces allergy reaction, for a patient who has was on anticoagulant program, and we need to avoid the heparin during the treatment. So we have a semi-natural fibers dialyzers that you would have with more biocompatibility for a patient. In addition to that, in case that you want to do hemodiafiltration of the patient and you have a problem in vascular access, so you will not be able to make a hemodiafiltration. We have super high flux dialyzer, sharp cutoff membrane for albumin retention and more clearance of beta-2 microglobulin. Okay, this kind of dialyzers have a more efficiency and you don't need to go with a higher speed of the dialyzers, especially for the patient who has inflammation. It removes the free light chain from the body in HD treatment and gives very high clearance with the retention of albumin.
So,
This technology, it's called physics. It's a glass that show camera. There's camera there and screen. The primary paramedic can see the command screen, and the camera can also reflect to the command center. So they can see everything the paramedic is seeing in the scene, and also he can see the screen in the command with the vital signs of the patient.
Okay, thank you so much.
our students to assess properly, to assess the eyes, to open the eyelids, which obviously open as very close to a human as possible. The silicone which is used gives you that sort of real life feel. You know, it feels very, very similar to human skin. So when you come up later on, really encourage you to get hands on with this person. You know, when we're from a training perspective, when we have our students assess casualties, it's really important that our students get hands-on with our casualties, as you would want them to do in a real-life environment, because that's how we're gonna a thorough assessment. In terms of interventions, then, so we'll start with the airway. So you can do anything from a nasopharyngeal airway with this particular guy, through to obviously an oral airway, to a supraglottic device, or with the use of a laryngoscope and the use of an endotracheal tube. So the airway itself was moulded from a human cadaver, so it's exactly the same anatomical shape and size and appearance. So obviously when you're looking through the scope, it looks exactly the same as it would do when you're performing this on a real patient. It will take needle decompression, so we have our own specialist chest decompression needles which can be used, and we can perform this. You can perform it many times. Intraosseous insertion, again, we have inside the mannequins, there's almost like blood banks, if you like. So if the intraosseous needle is inserted into the right place, we then get some feedback to the student. You can withdraw some blood from the sim body. Okay. Moving down, then you can put simple things on like a Russell chest seal for simulating of open chest wounds, and then with the use of moulage, which is provided with sim body, you can then simulate any sort of types of injuries you want. We have removable sleeves which can be taken away. You can add them to wherever you want on the patient. You can simulate certain, you can look for specific dressings of different types of injuries. Pelvic binders and things can be applied nice and easily. We have traction splints for simulation of a femur fracture. And on the inside, when you guys come up, you can see an open wound to his mid-thigh. You may have seen these little tubes, so we have one left and one right. These can then be connected to containers. We can put blood through them. Under pressure, we can then push blood through the limb. The blood will then come out the wound, so what we're looking to achieve is the patient to then control that bleeding. If they don't do it correctly, the bleeding will continue. Okay, if the student is then managing the bleed successfully, as it would do in real life, what we're trying to achieve is to get that real feel. On the right side, you'll see the amputated. So this is a sleeve. This guy's foot is being passed around the audience, but this is a sleeve which we can attach. Again, we can put the blood through the sleeve. This will simulate bleeding, okay? Simulate bleeding. Once the students are then putting on the tourniquets, we're trying to control that bleed. If they apply it correctly, they apply it tight enough, the bleeding will stop. If they don't, again, it's going to continue. So that student is going to get that real life feel. We have certain videos after this. Certain mannequins, our most advanced mannequin offers, different levels of interventions. We can do surgical airways, we can do open chest thoracotomies, all of which try to create that real life feel. So have a watch of the videos. If you've got any questions, please feel free to ask us, guys. And then I really encourage you to come up and have a feel and have a go at any interventions you want. So thanks for listening. Any questions, please feel free.
Right now, okay, start this, okay. Someone pull down, sudden pull downs due to the sudden cardiac arrest.
Yeah.
And I take this AED.
Yeah.
This AED and press and then press power button and follow 1, 2, 3.
Yeah.
That's all.
Yeah.
That's all. Yes. Press button.
AED in adult mode. Call for emergency medical assistance. Peel one pad from its liner and attach it to the patient as shown in the picture on the pad.
Yeah.
Repeat
This
the
one, yes.
process
And
with
this
the
is
other pad.
this is right and left.
Check the pad.
Okay. Yes. Right and left attach it. Check the pad.
Check the pad.
And then
Don't touch the patient.
yes.
Analyzing ECG.
Okay. Automatically analyzing ECG.
Analyzing ECG. Shock advised.
Check it right.
Charging now.
Charging now. Charging sound.
Push the flashing
Then press.
button.
Yeah.
Then press.
Shock is done.
Done. Fine.
CPR.
And then
Use both
and
hands.
CPR.
Overlapping
Yes.
the other.
Yes.
Push down
CPR
to the center of the
about
chest.
1 minute,
Pace
about
with
1
the
minute or
metronome.
2 minutes, and then repeat until there's arrival of the emergency teams. Yes. Yes. That's all. Yes.
Hello, Miss Crystal from USA. She is in conference, and I will ask her how's her experience to be in a global conference. Hello.
Hello everyone, this is my first time here in Saudi Arabia. It's very fantastic. It's fantastic and awesome experience. You know what only missing here is if you ask questions about their product, they're not into detail. It's like they're not really prepared about their product that they are selling. But there's a lot of vendors, all innovation that we learn from this, exhibition.
Dr. Salwa is with me, and she is a nephrology consultant, and we will talk about the global conference. How's her experience? Dr. Salwa, what is your experience regarding this conference?
Yeah, it's a huge gathering internationally. I am so excited to attend. Once I attend here, I saw a lot of friends. I saw a lot of foreigners. It's very, it's a good chance to do marketing for our company and to socialize with the others, to see the most of the medical instrument that can be used for our company. So I'm so excited. I am so happy to attend with Miss Crystal and Asad, and I am very happy to. It's a good experience. I like it very much. Thank you.
Thank you so much.